Thank you very much to the organizers, WHO, Dr. Nazi, and the entire SFDA team. Thank you very much for the warm welcome. And it was also a nice surprise to see Dr. Saleh back here. So it's always nice to come here, you know, and meeting friends. Yes, I work for Abbott Laboratories in Germany, but today I speak on behalf of MECOMED. That is the Medical Device Association for the Middle East, and they have sponsored, so to say, my presentation here today. I'm speaking about the industry perspective on pre-market regulatory control. So it's a little bit more complicated than to say industry doesn't want to have any regulations, right? Okay, so there are a couple of topics I would like to cover here. First of all, I would like to look at the regulatory, the pre-market approvals worldwide, as well as the impact to patients, industry, and when it comes to time to approval, cost, as well as safety. Briefly look into the pre-market inspections, and I would like to give then some conclusions and suggestions. Yeah, the regulatory environment, and as you heard before from my introduction, I know nothing else than regulatory affairs. That's, you know, what I have been grown up with. At the time, back in the beginning of the 80s, there was not so much regulatory. It was, you know, some, I would say, medical devices were an IVD medical devices, which is one of my subjects, you know, I'm concentrating on. But it was, you know, under the German drug law in that case in Germany. You know, we had here and there, for sure, you know, in the US, you know, there was drug regulations and so on, but there was not that much around. But it just started then in these years, especially also with the HIV assays worldwide. But now when we look at the whole environment, health technology assessments, that's one, you know, of our topics. It's a price cost driven environment. And there is another, I would say, movement where regulators say, you know, we have to be self-funding. So there's no extra money, you know, being given by the government, you know, to get these products approved. And I will speak about this a little bit. There's shrinking borders, common markets, globalization, harmonization. I was a little naive in the beginning of the 80s because I thought harmonization, globalization means, you know, one product approval and we can sell worldwide. Well, now, you know, I'm older and wiser. I know this will never, ever happen. This is a dream, but still, you know, I believe, you know, when it comes to harmonization, we can do a much better job in the future. And we also see, you know, that regulators are very risk adverse. And even we talk about risk management, it is very difficult. And to be honest, if I would be in your shoes, you know, I would probably, you know, react the same thing. I mean, you make certain decisions, you know, for your countries. And if these are bad decisions, you know, for sure, you know, you will be blamed in the first place. For sure, also the manufacturer. But that's a different story. Okay, look at the world. Currently about 80 countries are regulated for medical devices. And again, you know, when I show you the map, I look, you know, from the perspective for IVD manufacturers very much, but there's a great overlap. Currently, more than 40 countries are revising and strengthening their regulation. That's a big number, big changes. And most of the cases, there's no grandfathering, which means, you know, companies have to go again, you know, even it has been approved in certain countries, they have to do the process again. More than 10 countries are in process to develop brand new medical device regulations. So our hope is with them and all the others, you know, to come in future that, you know, they will see, you know, what's there, you know, and do not reinvent the wheel. Here's the map. And as you said, this is exactly what Josefina said yesterday, we see in Africa, we see more, there's still room for improvement for regulations. We also see then, we call them the STAN countries. But it's also because, we don't know. I mean, for example, I can speak for my company, we are not selling there right now. So therefore, we don't know exactly, what the environment is right now. But, and there are a couple of islands, and there is a little bit South Africa and South America, but there is not that much more to regulate. I always were predicting, just as a kind of joke to say, when I retire, the world will be regulated. I guess WHO will do their part to meet that goal, but I probably will not. I will not make it. Okay, so time to approval, and that's essential. And I would like, to, in my presentation, I will give you, a couple of interesting facts which have been collected over the couple of years. And I will look very much into a very regulated, very centrally regulated regulation, which is in the United States with the US FDA, and with their system of the 510K, PMA, pre-market approval, and BLA, for the biologic license applications. Compared to Europe, which is currently at least, we have, I can speak for IVDs, 80% of the IVDs are being self-declared in Europe, and only 20% go through a notified body. So, very much relying on the manufacturer, that the manufacturer is doing a good job, and having also the responsibility with the manufacturer. So comparing these both systems, this is all about these data. So it was interesting, that, and this is a study which has been prepared in 2012. That was from the Boston Consulting Group. That between 2000 and 2005, the average approval delay in the US to the EU was 38 months. Then between 2006 and 2011, it increased to 47 months. And they said that even, I think they said, by months, they even increased, somehow by 2.5 months. And it's, so a different study, and that was interesting because they basically confirmed the numbers, they showed a range between 3 and 17 months delay. So never ever, the US FDA approved something before Europe did. And there is a special case, I can share with you. We had a blood screening system in place. This was 10 years earlier in the EU market, and it's for 20 years successful in the market. It's the workhorse, I would say, in blood screening, but it was 10 years, later in the US market. And now, for sure it's also very successfully in that market, but that shows also, the very much, the major difference. Well, when it comes to reduced return on investment and increased uncertainty, and cash is needed, for bringing a new product to market, this does not really stimulate, the market. It doesn't stimulate manufacturers, to get these products to market. And so therefore, it reduces new innovations, but it also reduces competition. And competition is important, really, to control and get to better prices, right? So a high regulatory bar for changes of products increases costs. And you may not necessarily see this right away when you say, why is this? Well, because of all the regulations worldwide, not everyone, is getting a product approved at a certain time. So normally, this is a kind of 3-year time frame until everyone has approved, which means the manufacturer has to have 2 manufacturing lines to keep, the customers supplying, your product over these years until, the last regulatory body has approved it. So over the time, the product is getting for these countries extremely costly as well. Yeah, because if later on the manufacturer only manufactures for a certain country, somehow, he has to recover his costs. But on the other hand, he cannot just shut down his manufacturing line because, the customers and the laboratories would not have these products available. Okay, then next costs. We somehow talked about costs, but when it comes to registration fees, there is a range up to nothing. This is also possible, believe it or not, to $255,000 US, and this is only, the pre-market approval, okay? It's not, the BLAs, this is a kind of multiple. So sometimes, regulators, compared to the US, they say, oh, we are not that expensive, because in the US they are even more expensive. Anyway, when you look into, and that was also, a study, that they looked into all the FDA relevant steps and then added up the cost, you easily get you to 40 million US. And just another example from real life, if you want to get a laboratory system in the market, maybe you want to come up with more efficiency for the laboratory, smaller systems, something which really helps the customers to have a good laboratory practice in place with about, let's say, 150 assays, which are normal laboratory markers. There's nothing special. It's everything you find in a laboratory book. If you only look at the registration costs, you're looking for fees for the regulators, fees for the clinical studies. You are not talking instruments, you are not talking material, okay? Nothing, or the people being involved, preparing this. These are pure fees. You have to pay about 30 million US. And you have to sell quite a bit before, you have that money back in, right? And you haven't paid a person. And so therefore, you can see if a regulator looks into his budget, it may be, small, but it adds up, when you really want, to globally market this product and want to be successful. Again, regulatory bodies get pressure from their governments, to be self-funded. It's not, that the regulatory bodies themselves have chosen to do so. And as well as, implementing local studies drive costs significantly. Yeah, because it's not just giving, and doing the study, but with all the processes in place, this is significant costs. And high fees and costs and study costs, prevents especially small companies to introduce innovations and to make the required investment. But when you look into currently, into the market, especially for the IVD markets, then you will see, that innovations come from the small companies, right? These new biomarkers and so on. And then, so therefore, companies have to work together, really to get these things to market. Product safety. Extremely important, not for you as a regulator, but also for us as a manufacturer. And it's very interesting when you look into and comparing again the FDA with the USA, it's confirmed that there are no more recalls or product issues in Europe because, we have such a different system compared to the United States. And it's interesting, also again from this Boston Consulting Group study, is assume that there are more medical devices on the market because, you know, of the more simplified system. The numbers of recalls are even lower than in the United States. And it was also interesting because they looked into the reasons of all the recalls. And they looked into the EU, and the reasons for recall were 46% related to pre-market issue. So in design, for example, and in labeling, but only, not only, but 54%, you know, for post-market. When they compared this to all the recalls in the United States, they came up with 45% for pre-market and 55% for post-market. You would think that in the United States, because of this system they have in place, you would reduce, you know, more pre-market related recalls. That's not the case. So therefore, you know, it reinforces, you know, the findings that both systems, from a product safety standpoint, they perform very similarly. Pre-market inspection. That's a quite interesting topic because we will see more and more inspections. I think we had the peak, you know, in inspections that was in the year 2001, 2002. There was, you know, for the implementation of the IVD directive, the medical device directives. And I can speak for my company. We had about 56 audit days a year. Okay, I mean, basically, you know, normally we say everyone has 220 working days. Well, it's a couple of more, but anyway, I mean, it's a significant number, right? Every fourth day you have an inspector, you know, or a notified body in your site. It's not, you know, that they can do their work and we do ours. No, I mean, there is a lot of activities, you know, to be done. And then, you know, we had another peak, you know, with Brazil. Anvisa went out. They had a very, very ambitious plan. They really wanted to go out, you know, inspect every manufacturer, you know, and whenever you had a new product, you know, they wanted to come again. But it was impossible. It was impossible, even for such a huge organization like Anvisa. Fusion-related, Malaysia, Singapore, these are probably good examples. And others are preparing for pre-market inspections. We know China, Taiwan, Korea, Japan, they're all looking into it. We would love to see all the regulators in the world at our site, but clearly it's impossible. We would not be able to make a product and getting the product out of the door if, you know, we would entertain, you know, all these inspectors. So inspections may take about 1 to 5+ days, because United States, they may take, you know, whatever they can. I mean, they can even stay 2 weeks or 3 weeks. Several departments are involved, for sure, manufacturing, management, you know, to show management commitment, quality service, regulatory vigilance, environmental health, safety, training department, and so on. And an audit, it's not just these days, because, you know, you may want to do a pre-audit. You may want, like, for example, for the US, it's very typical to do simulation audits, you know, to do this, you know, with people coming from another division and helping out and playing the role of the inspector. You have to prepare for unannounced audits for Europe. You feel like, why that? Well, I mean, there are specific requirements, because when the auditors come at your site, you have to be able within 30 minutes to set up everything for this audit. And you have to train this, you have to do it, because if you are blindly running into this, you will not be able to do it. And you have to train it again, because people are changing, you know, and And this is all the preparation, for one visit a year. You have to prepare the responses of the findings. And, for sure there is continued communication with the auditors after the audit. So, in a summary, pre-market inspection, they're extremely burdensome to companies. They bind many resources. They are expensive exercise, and they are duplicative. Because I have not seen that a specific authority has seen, I don't know, something in addition. I mean, it was not, that I would say, Anvisa was on play, and on site they found something, the notified body was on site, they found something different. No, yeah. It's, in most of the cases, it's basically the same. Yeah. I mean, for sure, everyone has their specialty. If you have an expert, on water systems, then they will probably go into depth. But it's not, that we have learned something substantial. Patient impact. There are delays in access to new medical devices, right? There are limit in treatment choices, limit access to product, which could offer improved quality of life. That's for sure, because, when you are ready for the launch, and it may take up to 3 years, to get the products approved. 3 years can be a long time. In our case, 10 years, for a blood screening product, especially, when you could see, that we made really a big jump, in sensitivity and good manufacturing process, it was 2 years too late. What are the conclusions? So my kind of appel, to you to say, establish an efficient registration and notification process when it comes, to changes. Sure, you have to control what's in your market. And you can do this, if you would have a good listing program. Establish an efficient post-market surveillance system and control what's on your market. Go out there. Go and see your distributors, yeah? The hospitals, how are they using, the systems? As we heard, yesterday, and that's true, that most of the mistakes, really, on the user side. But it could be also a hidden design failure, right? So therefore, you really have to go out and find out. Well, 500,000 products, this is almost impossible. So, you have to have a kind of a risk management, to say, what's more risky, where I'm going more often than to others. Avoid changes in key personnel, because in continuity for a manufacturer is also very important, because we see sometimes, we go, with a bunch of assays, different reviewers, and we get different questions. And so that is also something, which we could avoid, a lot of issues here. And also training in the end, right? Because, you have to train, your personnel. Avoid any local studies, in-country studies, if not scientifically justified. You won't believe how often, we do specificity studies or sensitivity studies again and again and again. The product is not getting more sensitive by doing these additional studies, right? And even, if I would do it in my laboratory, I do not get any different results. And that should it be, right? I mean, so then establish a conformity assessment proportional to the risk of the devices. For IVDs especially, I must say, it's quite interesting, how they're being balanced, to other products. Many of the product clinical chemistry parameters, my goodness, that has been done 50 years ago, right? I mean, it's chemistry, there's nothing different. So why, get this, approved, and then even, asking for studies where you feel like, well, sorry, but it's just water, and some chemicals. request inspection reports from notified bodies, because if you cannot go around, ask for these inspections, right? There's nothing to hide. Especially, if inspected before, no duplication of audits. So avoid duplications wherever it's possible. And there is a last statement I would like to make is, try to establish something which is straightforward, avoiding duplication, and be predictable to the manufacturer. Because if he can plan, then all is fine. But if he is uncertain, then he cannot plan anything. And that's also not good for the patients in the end, right? And I would like to make, to say, there are, I would call, 5 countries or areas in the world, which are coming very close, what I'm talking about. There is first to name Saudi Arabia with their system. Then the EU, because the EU is even under the new system, you can develop your product while you pull these things together, and at the end, when you launch your product, you get your product approved. That's why it's very attractive for manufacturers. And by the way, we have created in Europe a lot of jobs because of this. Many companies came to Europe to build on that system and get the product manufactured in Europe. Singapore is another example. Johanna has been part of it to establish this. Malaysia and Australia. These are the 5 countries which are coming very close, but again, because they are avoiding duplications, they are not doing any studies where it's scientifically not justified, and they are predictable. And that's my last slide. Thank you very much. Shukran.